episode of the Hair Show. Today we are going to be talking about one of the most important aspects in terms of diagnosis and treatment of pattern hair loss, specifically when it comes to women. So, if you are somebody who suffers from female pattern hair loss, one term that you must have come across constantly every time you visit a dermatologist or a site to self diagnose yourself, everybody goes to WebMD, is basically the stage of hair loss. So you must have heard the term you're in stage 1 or stage 2 or stage 3. And well, dermatologists talk about it like everybody knows about it, but we know that this information is not very common. So today, help you understand what stages of hair loss mean. Okay. So let's start a little bit with the history of how this metric system came to be. So there were basically two sets of trials that are now widely known and used. One was done by Dr. Ludwig and the other was done by doctors Ebling and Rook. Both happened in the 1970s, and about 500 women were used in this trial, and the doctors studied the anatomy of the progression of the hair loss condition. So if you have watched our videos before, if you haven't, then please go and watch them. Basically, we talk about how female pattern hair loss progresses. So what happens is that your partition starts to get wider. In very few women, it is also possible that your hairline is receding, much like what happens in male pattern hair loss. So that is what is the progression of this condition. And if untreated, of course, it leads to partial balding. Complete balding is not something that happens in women quite a bit. So this is what the stage looks like. It goes from stage 1 to stage 6. And we basically want you to sort of understand what it is and how your diagnosis, your prescription, and the duration of treatment changes based on this. Okay, so let me quickly take you through the different stages of hair loss. As you can see, there are 6 stages here. From stage 1 to stage 6, and this scale of diagnosing female pattern hair loss is known as the Ludwig scale of female pattern hair loss. All right. So if you're in stage 1, what you would notice is that you have some thinning. Your partition is just starting to thin ever so lightly. To somebody who does not treat hair loss or doesn't know about hair loss conditions in detail will probably not even able to guess that you have this, but you will know it because obviously you're shedding more than normal hair, and at the same time you have thinning. If you see in stage 2, this partition is starting to become a little more prominent, right? So the thinning is a little more, maybe, when you look into the mirror, or, if there is somebody who's around you, they would be able to tell that your hair is starting to thin and, your partition is becoming wider. And then from there on, it basically keeps progressing in the stage 3 and stage 4 and stage 5 and stage 6. Basically, the degree of thinning in your partition increases. And of course, when we go to stage 5 and stage 6, it is also possible that there is a strip in your partition that is completely bald, which means it does not have any hair at all. So it has gone from hair thinning to becoming sort of a bald spot or a bald strip, basically. So that is what the different stages of hair loss look like when it comes to female pattern balding. So the most commonly prescribed serums, medicated serums for female pattern hair loss are minoxidil in the concentration 2% or 5%, or redensyl in the concentration of 3%. Of course, in another episode, we have spoken quite a bit about minoxidil, about what it is, how it works, and what the concentration means. So I would suggest that you watch that episode on minoxidil to understand it better. But basically what minoxidil does is that this thinning, or this basically widening, is caused by the shrinking of your follicles. So minoxidil ensures that they don't shrink any further and that you see regrowth of thick, healthy hair back in those portions. So, and redensyl does the same thing, except redensyl has natural origins. It is basically made from plant extracts and is relatively new, whereas minoxidil is about 30 years old in terms of the fact that the prescription first came into being in the 1970s. Redensyl is relatively new. It was introduced on a large scale globally in about 2014. But it is very effective. So when you are in between stage 1 and stage 2, you can either be prescribed minoxidil 2% or you can be prescribed redensyl. But if you go to stage 3, stage 4, stage 5 and stage 6, the best bet for you is minoxidil. So most important thing that these serums are going to do is that they're going to stabilize your condition, which means that it will make sure that it does not get any worse. And then depending on how long you use it for, how well your care, your treatment regimen is drafted in terms of the diet that you're taking, your lifestyle, the other medication that you're taking, will determine the degree of improvement or recovery of volume, what is known as regrowth. So, two of the most common questions that we come across when we interact with a customer is basically how much time is it going to take for me to see an improvement, and how much improvement am I going to see? And the two things that this depends upon basically is the age that you are at when you have an onset of the hair loss or when you decide to start treating it, or the stage of the hair loss that you're in. So let's cover the thing that we have here with us right now. In terms of stage, if you are at stage 1 or at stage 2, then your treatment duration, if you follow it properly, if you take the medicine continuously, should be anywhere between 3 to 5 months. Around the 3 months barrier is when you will start to see that your condition is stabilized, in the sense that you should not have any active hair fall, or it should have reduced quite a bit and your thinning is reduced, and then it takes about 2 more months for you to see a recovery in terms of volume, where your hair shaft becomes thicker. If you are between stage 3 and stage 4, then the time that you are going to take to see results is going to increase slightly, from 3 to 5 months to 4 to 6 months. So it will take you about 3 to 4 months to see a stabilizing effect, and then thereon by 6 months you're going to see some amount of recovery. And of course, the degree of recovery is going to vary. What I mean by that is, if somebody comes to me at stage 1 and stage 2, I can maybe confidently tell them that if they treat the treatment continuously, they will see 80-90% recovery. And that is really possible, especially if you're young. But if somebody comes to me at stage 3 and at stage 4, then I would probably tell them 60-70%. So that is why it is important to treat your hair loss in the early stages, as soon as you realize that you have the problem, and not wait for it to get worse. Preventive treatment is the best option for pattern hair loss. And now when we move to stage 5 and stage 6, the recovery period can go to 6 to 8 months. If you are beyond stage 6 or in an advanced stage 6, it can even take 1 year. And of course, the recovery percentage will also be much lower. I would optimistically say between 40 to 50%. But in any of these stages, if you start minoxidil or if you start redensyl, the one thing that would definitely happen is that there would be stabilization, which means that your condition would not get any worse. Okay, so now coming on to the second part of, whether you're going to see improvement or not, is age. So anybody that is between the age of, let's say, 20 to 35 is going to see improvement much sooner than somebody who is, let's say, between the age of 35 to 50. So if you are a 35-year-old at stage 1, and if you are a 35-year-old at stage 5, the duration of the duration that it is going to take for you to see improvement is going to differ. So let's say I have a customer who is 20 years old and who's at stage 1. This is the best time for you to start treatment, because you can make sure you never progress any further, versus somebody that is at stage 5 and at 20, because they will take longer. But if you are at stage, basically, let's say you're 40 years old and you're at stage 4, then your recovery period might become longer. So there is a very strong correlation between the stage and age of hair loss. Another thing that I want to point out when it comes to female pattern hair loss is that because women have onset of periods, they have delivery, the pregnancy, basically post-pregnancy, and they have perimenopause and menopause, it is possible that there is fluctuation in your hormonal health, which can either make an existing hair loss condition worse. Women that have hair loss before pregnancy, post-pregnancy, the volume is much worse. So don't get alarmed. It's completely normal because of the hormonal changes that you're experiencing. Same goes for the women that are in perimenopause or menopause in the age of 40, 50, 60, whatever. If you are suddenly seeing hair loss, it could be age-related, or it could be because of hormonal imbalance. And both of these things can be managed. If not completely improved, it can definitely be managed. So it is important that you get treatment no matter when you see an onset of hair loss. So we hope that through all the information and gyan that we've given you today about the stage of hair loss, about the prescription and how it is correlated to your stage, about the duration of treatment and how it is correlated to stage, you now are in a better position to understand your diagnosis when you have somebody say to you that you are at stage 1 or stage 2 or stage 3, and also that you will be much quicker in taking action when you see hair loss, because you understand the importance of starting treatment at a certain stage versus another stage. So thank you so much for your time.